Hello, this is Colleen Clancy, WGU MSN student, and I will be speaking on my capstone project of engaging staff nurses to achieve specialty certification and educational innovation. We will be looking at the slides as I am speaking. Excuse me. Introduction. Rates of nursing specialty certification are lower at the Swedish Medical Center Ballard campus than national standard. Increased rates are necessary for Pathway to Excellence continued designation, increased nursing staff satisfaction, and to provide evidence of high-quality patient care at the facility. After we did research and a literature review, a new multimodal certification review course is proposed. The multimodal format includes distance learning with limited in-person sessions. Explanation of how this gap was addressed. An educational gap was identified. A certification review course has never been held at Ballard. Literature shows lack of access to a certification review course and educational materials are barriers to nurses achieving certification. Solomon et al. 2016 stated barriers, real and perceived, often influence a nurse's willingness and ability to pursue certification. A multimodal format with accountability measures was shown in the literature to increase nurse certification rates by a large percentage. Explanation of how gap was addressed, slide 2 on this aspect. Higher pass rates than national average were also seen utilizing the multimodal format. The work of Sierzinski and Serwetnik, 2015, showed that utilizing the multimodal approach yielded a 93% completion rate on the certification exam. Excuse me. Falker, 2014, showed a 96.5% pass rate on the CMS RN exam versus the 78% average with a multimodal review course. Page 12 on that article. The CMS RN exam is the Certified Medical Surgical Registered Nurse exam that is administered through AMSN, the Academy of Medical Surgical Nurses. There are two ways that a nurse can achieve the medical surgical certification, and this is one. The other way is through ANCC, and that credential for a certified medical surgical nurse is RN-BC, RN board certified. Best practices, therefore, were for organizations to host an in-house multimodal certification review course. Overview of steps. Gauging the interest of staff, start with an email survey or hold an information sack lunch session. There could be a professional development forum discussing certification, professional associations, and conferences. Approval from management is required. The money is a big factor. If they won't approve a budget for this, which we'll talk about in a later slide, it couldn't go through anyway. So those two steps sort of dovetail with each other. If enough interest is shown, the certification review course should start in 4 to 6 weeks to maintain interest. Okay, I'm just going to stand up and do it this way. Lesson topic. The certification review course will be scheduled over 12 weeks. The focus of the first review course will be the medical surgical nursing exam, as the largest number of nurses qualified for this specialty at the Ballard campus. A limited number of in-person review sessions will be held with distance learning and readings prior to class. The integumentary system, nursing assessment, treatment, and interventions is one example of a lesson topic from the in-person sessions. With a 12-week class, you have room for all 11 body systems plus topics like isolation procedures and grief and loss that will be on the certification exam. So this is teasing out one lesson topic out of all that will be presented, and we'll go into a bit more detail on that. Learning objectives for the integumentary system lesson are to identify nursing treatments for pressure injury stages 1 through 4, Select at least 3 nursing interventions to prevent pressure injuries. Analyze nursing assessment for signs and symptoms of wound infection, and explain patient teaching for at-home diabetic foot ulcer care. Teaching and instructional strategies. Active learning will be used during the in-person review sessions. Students will be assigned to group study tables to complete the content presented. For example, if you had 12 people in the class, you could separate that into 4 tables of 3 or 3 tables of 4 as an example. Adding a timed component helps move through the material faster within a limited session time frame. I think we've all been in class where that one person asks a question that takes you off on a tangent for 15 minutes and then you can't address all the material that perhaps more students had questions on if you hadn't been derailed by that one question earlier in the lesson. Engaging learners in activities encourages collaboration with peers and gives a component of kinesthetic learning that translates to bedside nursing practice. Students will be expected to read assigned articles prior to class meeting time. There will be 5 live sessions. Required materials. These are 2 examples of articles. The first is Jeffcoat, Villicite, Boyko, Armstrong, and Bolton, Current Challenges and Opportunities in the Preventions of Diabetic Foot Ulcers in Diabetes Care Magazine. There is a DOI on that. Nizarko, Choosing the Correct Wound Care Dressing, an Overview in the Journal of Community Nursing, Volume 32, Issue 5, pages 42 to 52. There's not a DOI for this article, but it is available in both articles can be accessed in the online Swedish Medical Center library from work or from home. You can put this title in just like the Google search bar and it will bring up the article. She's got really good tables in there of different dressings. It's actually a very detailed article. I like that for wound care very much. Student learning outcomes. Utilize nursing assessment, treatments, and interventions to provide high-quality patient care. Evaluate and apply evidence-based methods to deliver safe nursing care to individuals, populations, and communities. Succeed in acquiring national certification in medical surgical nursing. So those are the overriding learning outcomes for the entire course. Lesson plan details. So here are 2 of the things that will happen during the integumentary system lesson. The first is the match game. Pictures of each stage of pressure injury, like one piece of paper here, and sheets listing the description and treatment will be given to the tables. Students must correctly match each picture to its proper description and treatment. The table of students finishing in the fastest time will be first place. So once they match them up and call time and you see if they've correctly matched it, that table is first place. So that's adding the timed component. And it also mimics how time compressed bedside nursing can be. The nurse intervention race. This is really fun. 2 tables will be set up with items for prevention of pressure injuries with items that are not for that use as well. A timer is set and students will race to bring back the most correct items to their table. The fastest time with correct interventions is the first place table. So this very much has that kinesthetic learning aspect and muscle memory of a bedside nurse going into the supply room and looking for something to help prevent pressure injury to the heels of a patient, perhaps picking up pillows. We'll put pillows on the table. We'll put foam dressings for sacral injury prevention. And maybe you'll put like a toothbrush, which is not for pressure injury prevention. So that mimics making a quick decision as to what treatment you'll use for your patient to prevent pressure injury. Success methods. The primary intended outcome of the educational innovation would be for all participants in the certification review course to sign up to take the certification exam. The second intended outcome would be for the majority to pass the exam. Additional outcomes would be for the nursing participants to recommend the new educational program to other nurses and encourage nurses who have not yet achieved certification to pursue it as a professional development goal. Decision-making processes. Approval must be received from management before proceeding with the review course. Finance department must set a budget and pay codes for nurse educators leading the course. Information technology leaders will weigh in on available hardware and best practices for the distance learning platforms and educational software. Facilities managers and environmental services personnel will help schedule conference room time and arrange setup and cleanup after in-person sessions. Successes. If successful, the review course will be scheduled for twice a year with targets of fall, winter, and winter-spring sessions. The course could be expanded to other campuses with higher-level executive support. There are 5 campuses in the Swedish system. Our Ballard campus, First Hill, Cherry Hill, Edmonds, and Issaquah. So those are potential places that could be expanded to if successful. The format of the certification review course could be expanded for nurses interested in other areas of nursing for certification, such as emergency, critical care, pediatrics, behavioral health, or obstetric nursing certification. The challenges of this. The initial challenges for the certification review course may be finding enough staff nurses interested in pursuing specialty certification. Promotion of the first iteration of the course will be crucial. Ensuring the budget is appropriate for the course will require some flexibility from management. The challenge of ensuring staff nurses sign up for the specialty certification exam is lowered by holding an in-house course as seen in the literature. That was at least 15% higher pass rate, if not 20 on that one Falker study. So that's good evidence that this works. Pass rates will be examined after the course to see if the curriculum and instruction met learner needs. Discussion of organization's plan. Implementation of the certification review course in the short term requires financial outlay. Nurse educators will be assigned to the project and unavailable for other duties. Advertising such as flyers will promote the course. Long-term support involves the continuation of dedicated resources in the system budget. So the money will be a pretty, it's not a costly way to implement something, but that may be the sticking factor. We have to make sure management has a financial commitment. Meetings will need to be scheduled with managers, nurse educators, and interprofessional colleagues to discuss ongoing requirements of the course. This could be added as an agenda item to existing meetings, but there probably will come a point in time where a separate meeting will need to be scheduled. Discussion of resources. Resources for implementation of this project are reasonable with the multimodal format. Nurse educators for instructional time and curriculum development will require labor dollars. Technology may be the biggest investment. Budget dollars for software, hardware, and subscriptions or fees is necessary. There are minimal costs for environmental services personnel to set up and clean up the conference room. Environmental services is an often overlooked factor in how successful a program is. Attendees often rate conferences and seminars, classes, on the comfort of the room, too hot, too cold, and whether it was clean or not, and whether the closest restroom was clean or not. So it's a small factor, but it could be a big factor in the rating of the program. Description of MSN outcomes. MSN Outcome 3 is to design innovative nursing practices to impact quality outcomes for individuals, populations, and systems congruent with ethical, professional, and legal standards. This impacts quality outcomes and professional standards. The multimodal certification review course based at the Ballard campus will improve outcomes such as falls for patients as shown in the literature. It's an emerging area of research of the correlation between certification and patient outcomes, such as nursing quality indicators, falls, central line associated bloodstream infection, catheter associated UTI. There's not a whole lot of research yet, but some is starting to come in, especially on failure to rescue. If the nurse doesn't notice that the patient is getting worse and doesn't call the doctor, the outcome for the patient can be very bad, up to fatal. Increased numbers of certified nurses will also help the facility meet Pathway to Excellence quality designation standards for high-quality patient care. Nurse satisfaction is improved with achieving this professional development milestone. There was evidence in the literature of decreased turnover and increased nurse satisfaction with leadership support in achieving specialty certification for nurses. Description of MSN Outcome 2. MSN Outcome 6 is to design organization and leadership systems that promote high-quality patient care delivery and advance lifelong learning. This type of program has not been offered by the Swedish medical system before, so it's definitely an organization, a new organizational system. According to the American Board of Nursing Specialties, specialty nursing certification is the standard by which the public recognizes quality nursing care. ABNS 2016, that reference is on the back page, references as well. Achieving specialty certification is a primary means for nurses to engage in lifelong learning. The means of professional development, specialty nursing certification is one major way to achieve a professional development milestone. One of the others being going back to school, but not everyone wants to go back to school. This also, by achieving specialty certification, this also promotes lifelong learning in that to recertify, to re-up your certification, you're required to do continuing education. Certifications are usually good for about 5 years. When you go to re-up your certification, they ask what you did for continuing education hours. There's usually not a specification of what conference to go to, but it encourages nurses to seek out opportunities for lifelong learning, seminars, conferences, etc. Support team. Organization leadership will need to give approval. Nurse managers will promote and encourage staff nurses to pursue certification as a professional goal. Nurse educators will develop curriculum for the course and provide instruction. Information technology will help set up software, check system requirements, and troubleshoot with students having problems with connecting to the distance learning platform. Information technology, it will be really important to have a strong support team there because that could make or break the program. Students having different technology, the availability of hardware, computers, headphones, that sort of thing to do webinars if that's the way we go. That's going to be very important. References. The first reference, American Board of Nursing Specialties, as I just mentioned, 2016 ABNS fact sheet. And there's the retrieval. It's very easy to find, actually. Falker, 2014, development of an in-house review course to increase med-surg certification in Med-Surg Matters 23.6, pages 1 to 13. This is a magazine I actually get. It is also available in our Swedish online library and all the major medical search engines. It doesn't have a DOI, but the reference was about half a page long, and that seemed like a waste of ink toner. But it is very easy to find online. Solomon, Lahi, Bena, and McClelland, 2016, Strategies to Influence RN Specialty Certification in Nursing Management. There is a DOI reference on that. Zoom in a bit here. That's a very good article with very good research. I hope you have enjoyed this presentation. And since you made it through the whole thing, I'll show you the Mardi Gras parade going on below my window. We're happy this is over. Bands and a float. The floats. Yeah, there's the float. They're throwing beads. So thank you, WGU. Hopefully I am finished with my program. Let's celebrate. Bye.